Number 1. Asthma is a common long-term inflammatory disease of the airways of the lungs. It is characterized by variable and recurring symptoms, reversible airflow obstruction, and bronchospasm. Symptoms include episodes of wheezing, coughing, chest tightness, and shortness of breath. These episodes may occur a few times a day or a few times per week. Depending on the person, they may become worse at night or with exercise. There is no cure for asthma. Symptoms can be prevented by avoiding triggers, such as allergens and irritants, and by the use of inhaled corticosteroids. Long-acting beta agonists, LABA, or antileukotriene agents may be used in addition to inhaled corticosteroids. If asthma symptoms remain uncontrolled, treatment of rapidly worsening symptoms is usually with an inhaled short-acting beta-2 agonist such as salbutamol and corticosteroids, taken by mouth. In very severe cases, intravenous corticosteroids, magnesium sulfate, and hospitalization may be required. In 2015, 358 million people globally had asthma, up from 183 million in 1990. It caused about 397,100 deaths in 2015, most of which occurred in the developing world. Number 2. Arthritis is a term often used to mean any disorder that affects joints. Symptoms generally include joint pain and stiffness. Other symptoms may include redness, warmth, swelling, and decreased range of motion of the affected joints. In some types, other organs are also affected. Onset can be gradual or sudden. Arthritis is a term often used to mean any disorder that affects joints. Symptoms generally include joint pain and stiffness. Other symptoms may include redness, warmth, swelling, and decreased range of motion of the affected joints. In some types, other organs are also affected. Onset can be gradual or sudden. There is no known cure for either rheumatoid or osteoarthritis. Treatment options vary depending on the type of arthritis and include physical therapy, lifestyle changes including exercise and weight control, orthopedic bracing, and medications. Joint replacement surgery may be required in eroding forms of arthritis. Medications can help reduce inflammation in the joint, which decreases pain. Moreover, by decreasing inflammation, the joint damage may be slowed. Number 3. Diabetes mellitus, commonly referred to as diabetes, is a group of metabolic disorders in which there are high blood sugar levels over a prolonged period. Symptoms of high blood sugar include frequent urination, increased thirst, and increased hunger. If left untreated, diabetes can cause many complications. Acute complications can include diabetic ketoacidosis, hyperosmolar hyperglycemic state, or death. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcers, and damage to the eyes. Diabetes is due to either the pancreas not producing enough insulin, or the cells of the body not responding properly to the insulin produced. There are 3 main types of diabetes mellitus. But although none of them can be cured by any disease. Number 4. The human immunodeficiency virus HIV is a lentivirus, a subgroup of retrovirus that causes HIV infection and over time acquired immunodeficiency syndrome AIDS. AIDS is a condition in humans in which progressive failure of the immune system allows life-threatening opportunistic infections and cancers to thrive. Without treatment, average survival time after infection with HIV is estimated to be 9 to 11 years, depending on the HIV subtype. In most cases, HIV is a sexually transmitted infection and occurs by contact with or transfer of blood, pre-ejaculate, semen, and vaginal fluids. Non-sexual transmission can occur from an infected mother to her infant during pregnancy, during childbirth by exposure to her blood or vaginal fluid, and through breast milk. Within these bodily fluids, HIV is present as both free virus particles and virus within infected immune cells. Many governments and research institutions participate in HIV/AIDS research. This research includes behavioral health interventions, such as research into sex education, and drug development, such as research into microbicides for sexually transmitted diseases, HIV vaccines, and antiretroviral drugs. Other medical research areas include the topics of pre-exposure prophylaxis, post-exposure prophylaxis, circumcision, and HIV, and accelerated aging effects. Unfortunately, it can also be not cured. Number 5. Sickle cell disease, SCD, is a group of blood disorders typically inherited from a person's parents. The most common type is known as sickle cell anemia, SCA. It results in an abnormality in the oxygen-carrying protein hemoglobin found in red blood cells. This leads to a rigid, sickle-like shape under certain circumstances. Problems in sickle cell disease typically begin around 5 to 6 months of age. A number of health problems may develop, such as attacks of pain, sickle cell crisis, anemia, swelling in the hands and feet, bacterial infections, and stroke. Long-term pain may develop as people get older. The average life expectancy in the developed world is 40 to 60 years. This disease is inherited from parents. The lifespan of the young one depends upon the type of inheritance. If the condition is heterozygous, the young one will survive with anemic disease, while if the condition is heterozygous, there will be immediate death of the infant. Thanks for watching this video. Subscribe the channel for recent updates and like and share.